Good evening to everyone. I'm John Dogba. So, to address your first question that is asking in terms of what is post-mortem testing, post-mortem testing in short refers to the testing of the dead. Usually, in epi-surveillance, what we refer to as epidemiological surveillance, we do testing of dead bodies to ascertain the cause of death and how that relates to disease. You want to establish what the person, what killed the person, so you do testing to find out in terms of investigating the cause of death. So to address the second question, it is very important to do testing of dead body if you have an outbreak, especially when you are dealing with an infectious disease. And this is important because it helps you understand in the case of unknown cause of death. You want to establish what the person died from, the disease that currently causing the outbreak, and they will be able to help you in terms of guiding you in detecting or hotspots where you have the diseases that you are now currently having under surveillance, and that can guide you in your strategy for intervention. So it's very important to do testing of the dead to understand in the case of unknown cause of death. You want to know whether the person died from an infectious disease to be able to take the necessary precaution or to be able to guide the public in terms of ensuring public safety. So, in view of coronaviruses, when you look at the current outbreak, we currently doing testing for dead bodies to be able to help us in guiding our intervention in terms of our strategic intervention or to put in public health measures to avoid the spreading of the disease in a hotspot or cluster or in a community. So this is important because when the person dies, it gives you a clue in terms of understanding what the person died for, and mainly in an outbreak situation like we have currently ongoing globally, you want to know because people will not come out and see the truth. One, two, people may not know that they or die from the disease. Family members may not know. So you want to protect those that are still living. You want to be able to protect those that had contact with that person that died, and even friends and family members that will be coming or for various ceremonies like burial ceremonies, like mourning ceremonies. You want to protect the general public, so that is very critical in outbreak situation like what we experiencing now globally. So the next question is asking why post-mortem testing when there are reports that coronavirus is inactive once the person is dead. Yes, the person has died, and it's important to do post-mortem testing because that is the last point you have to establish or confirm diagnosis if that person died from coronavirus or not. Now, the essence of testing is not for the person that have died, is for those that are still living that might have had contact with that person, that might have been exposed to the virus, that might have been high risk contacts or low risk contacts. Now, the essence is you want to prevent people or you want to be able to isolate in a timely manner people that are high risk or that are high contact or that have been exposed to the disease or the virus that may come down with the disease. So you want to take public health measures to protect those that are living. And if you don't do it at that point, you might not be able to get it again. So that is very, very important for us to understand that the family members that are still alive, the children, those that were caring for that patient, they are high risks. They are high risks depending on what they were doing and what measures they were taking. So usually because we care for our loved ones, we show affection to them when they are sick, we care for them, we feed them, we take care of them. We do things that will not be protective. In fact, you might not even know that that person might have died from coronavirus. So testing of the dead will be very good to be able to give you a clue in terms of protecting those that are alive, protecting your family members so that those that might have been exposed can be isolated in a timely manner and monitor for the temperature to see if they will come down with signs and symptoms of the virus so that they can be adequately taken care of. And once you isolate in a timely manner, you want to try as much as possible to break the transmission chain. Thank you. So, the question regarding when is it feasible to test in terms of post-mortem? So, first of all, early notification is very important. So, once the person has died, is very important. That's where we are making use of what we call our CEBS, CEBS. CEBS have to do with community event-based surveillance. So, the way it works is that the community volunteers or the contact tracer or those that have been recruited to do engagement in communities, when they have information about someone dying, they first of all report that so that the county health teams in the various counties are alerted, and then you will send a team to go and do an investigation. So that investigation, once it's done, the dead body management team will go in, and then the laboratory team will be called upon. The reason for this, you have to get all the necessary information of who that person might have had contact with from family members that are available, loved ones, and all of that. And you want to get the body in a secure place, especially until you have the test result. So, so that you we try as much as possible. So now these contacts, you get the names of these people, what they do, their telephone number, terms of contact numbers, who they have had interaction with, and specimen will be collected from the dead body or the post-mortem. So one specimen collected according to the US CDC, and so then there are several specimens that you collect based on the test you are doing. So you can collect blood specimen, you can collect specimen from what we call the nasopharyngeal, or you can get oropharyngeal specimen. So that is, you'll be able to collect some specimen from the nasal cavity, and you also collect some specimen from the mouth. You talk about the oropharyngeal. Now, this is very important because once the person die and they have taken a long time, you might not be able to open the mouth or the jaw to be able to get to the 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 oropharyngeal. So is that mean to get the specimen from the mouth, because the jaw will lock after a period of time, and you will not be able to get it. So that's why early uh alerting the health authority very early is very important. So, and if it's not possible to collect from there, the next place that you will have to collect the specimen from will be through the nose. So you go through the nostril and collect it from what we call the nasopharyngeal at the back of the nose, where you will put in using the swab to collect specimen, and that specimen will be transported for testing. So it's very important for the specimen to be, or once it's collected, it be put on cold chain. That is, you try to maintain a temperature between 2 or to 8 degrees, uh, and or in the cool box, you want to have the temperature remain or maintain, and you have this swab put in what we call the viral transport media, the VTM. The viral transport media will try to keep the virus inside, yeah, so that it doesn't disintegrate. And then you want to also have it transported to the testing center in a timely manner, mainly within 24 to 48 hours. Once you collect the specimen, you should try to get it to the lab for testing. So regarding the numbers in terms of differences currently between the post-mortem and other confirmed cases, I'll refer you to the Public Health Institute or daily bulletin that is published. So in the bulletin, and also in what we call the sit rep, as the situation analysis that is given on a daily basis, you will see that we have the breakdown in terms of death as a result of COVID, and you have death occurring in treatment center, that's corona treatment centers. You have death occurring in health facilities, and you also have death occurring in communities. So now, that is why we are saying, and you have also data on recovery and all of that. So you see the recovery data, you see that is we have a very high recovery rate in terms of people that are going to the treatment unit. So if we are having high recovery unit and we're having less case fatality compared to those that have been tested, why should people remain in communities? It's only important that we encourage people to come out, because the sooner you come out, the earlier you come out. When you are taken to the observation center and your test is done and you found to be confirmed, what is going to happen is that you are going to be taken to the treatment unit and you're going to be careful. Now, what happened at the treatment unit is that some people go there, though they have been confirmed, but clinically they are not ill. That is, They are healthy, they are moving around, or they are asymptomatic carriers. So, asymptomatic carrier means someone will have the disease, but the virus within the system, but they are not sick. They are not showing it. So, you see some people, they are healthy. So, what happens is that it's good to protect them, first of all, by isolating them from the general population. That's one. And the second portion of it is that it's also good because once you are in a treatment unit, your vital signs have been looked at on a daily basis in terms of maybe 3 or 4 times a day. The nurses will come to do your blood pressure and other things. So if you have other complications and once you start to show signs, what you present is what they try to or take care of right away. So that is very important because it does not allow you to go into a critical situation, unlike the situation where you were home. So if you were home and start to come up with or complications, you wouldn't know and it will be difficult. And if you stay at home or in the community, by the time they take you to the treatment unit, it's already late. You have gone into the late stages. You have started to show different complications in terms of them. So that will make it difficult for you to manage. So the earlier you present and once you are tested and confirmed, it's always advisable and good for you to go to the treatment unit to get care. Yeah, so questions regarding the virus being transmitted after the person is embalmed. The first thing you need to understand about coronavirus is that, especially COVID-19 or any infectious disease, is you have to take into consideration what we call biosafety and biosecurity. So when you're looking at biosecurity, biosafety have to do with you taking measures that will protect the individual, the environment, and the general population. And biosecurity has to do with you protecting the general public from infectious substances, from theft, from bioterrorism, or being used as a weapon in bioterrorism, and all of this. So we are looking at coronaviruses and seeing, especially with regard to COVID-19, it's very important to protect the general population in terms of uh, guarding them from things that are harmful. So you also want to protect the general population and taking into consideration the global health security agenda, you want to protect the world, the global community. So why would you want to take a COVID confirmed body and send it to a morgue to be embalmed? This is wrong. This is not or something that is uh, so what we want to do is that it has to be under control environment. So we should always understand that the possibility of bio or highly infectious bio or biological substance falling in the wrong hands is going to cause problem for us. So if you know that this case is a confirmed case and this is taken and people get this, is we should always consider like Ebola, we don't want infectious substances to be there in the open. So if it has to be, for example, the person died, they were already taken to the funeral home, they were embalmed. Definitely, what we should understand is with viruses, any virus, when the host dies, the virus will also die. In the absence of a host, the virus cannot be able to survive. The virus is dependent on the host to survive. So is coronavirus because the virus depending on the host body, the host system to generate viral particle for the virus to be able to replicate within the host. So once the host died, the virus is going to die. Now, what we should look at in terms of the level of infectivity comparing coronavirus and Ebola virus is different. With Ebola, at the point of death, we know that the person is the virus has reached the highest peak where it has consumed the person's whole system and the person dies. So definitely once the person dies and then is not having any possible contact to get in contact with a living cell, the virus will also die in the host. So it's very important for us to understand that the first thing is that when people die, it's not good for people to play with the body. You should contact the health authorities. You should call 4455 for the requisite people that are trained in their body management to come and take charge of the body. And now, usually when the body is taken, the body is carried to isolated area or safe place that where you have people trained. Yes, at the funeral home you have people trained to take care of body. So the team goes in and collect the sample, and the sample is taken to the lab for testing. And once the result is given, if it is negative, the family they turn the body over to you and you go ahead and so on. If it is positive, it depends. The family can be asked to go and do the burial along with the dead body management team, where it's done in a safe and dignified manner. Now, this is the health system supporting you to do your burial in a safe and dignified way, where the general public safety is ensured and biosafety and biosecurity measures are taking place, are taken into account, so that this can be properly taken care of to not expose further other people. Uh, Now the question regarding whether we are testing every or post-mortem sample. So what happens in every public health or outbreak investigation is that you come up with what we call the standard case definition. So the standard case definition it guides in terms of looking at critical signs and symptoms that kind of define the particular condition that you are looking at. So the standard case definition will require you looking at the person that died to see if they show signs and symptoms, and if those signs and symptoms were they were in relation to the standard case definition that define coronavirus. So if the person died from, for example, from pneumonia-like illnesses, the person had they were coughing, they were showing or signs and symptoms, they were having fever and all of that, that clearly states that it meets the case definition for coronavirus in terms of being a suspected case, then this is very important for families and relatives to be very nationalistic and come out and inform the health authorities so that specimen is collected to be able to test. Now, it's also very important for the public to be very responsible, and communities to also be supportive of families that take this initiative to come out to save the general public by providing this information, so that this family will not be stigmatized. People will be supportive, and yes, not stigmatize the family because they have come out to see this, or people came to collect or sample for coronavirus. Maybe the person died from coronavirus also. So this is helpful for everybody, the family, the community, the population as a whole. So we should be very supportive of this, and we shouldn't try to stigmatize. And this should be very critical for us to share this with community members and other people to know. So it's important for us to be informing the health authorities. If you have now, you don't have to sit and allow the person to die. If you see someone that is sick in your community, the person is coughing and other thing, you can be what we call the US CDC term as a disease or detective. So disease detective is someone who sees someone that is sick, showing signs and symptoms, and does not wait for that person to something, but inform health authority or inform the community leadership that, oh, so person is not well. It's only good for us to alert the authorities so that they can come and check. So this is being protecting one another in the community, and it's very important, especially once you are experiencing an outbreak situation. So this has helped a lot in terms of people from different communities, from different counties, informing the health authorities, and sample being collected for testing. And sometimes the test show that is positive, yes, it's confirmed, and in other cases, the test show that it's negative. So once it's negative, the relative can go ahead and do their burial. Hello. Okay, thank you. So to address the question that talk about how do you conduct post-mortem tests, what we are really doing, and the question also, when you're talking about post-mortem tests in the era of COVID, I want to be specific. You are talking about collecting sample from someone that have died of unknown causes, that you want to be able to clearly define to rule out whether the person died from COVID or not, or you're talking about someone that had been suspected of having COVID and had died in the community, or known causes, and you want to rule out whether the person died from coronavirus. So this is very important. So what is done here is that the specimen is collected. The specimen is collected, and depending on the testing platform you are using, some platform uses blood, other uses or nasopharyngeal swab and oropharyngeal swab. So these specimens are taken to the lab and a PCR test is performed to be able to establish diagnosis. So this is very important. Referring to the question that talk about autopsy and post-mortem tests, for the sake of this discussion, we are limiting to or post-mortem testing. So when you talk about autopsy, you're talking about you want to establish fully what caused the person death. And mainly in cases where you people will like or want to have a full autopsy is if there is suspicion about foul play of the person death, or in a criminal case where it's suspected that this person or alleged that this person has been murdered, and you want to establish the cause of death in terms of linking a particular suspect to being the one that perpetrated the act. So what we're looking at here is mainly looking at being able to collect specimen from someone that died, where you'd want to rule out if this person died from coronavirus. And this is quietly different from doing a full autopsy where you want to look at the organs, you want to look at everything to tell whether the person died from suffocation or the person died from chemical poisoning or something. So establish autopsy is where you do an in-depth investigation, scientific investigation to find out what caused the person death. But in the case of post-mortem testing here, what we're looking at is this person has died in the community. We want to see if this particular person died from coronavirus or not. So you're not going to do a full autopsy on that person. What you're going to do is collect specimen to do testing to rule out coronavirus. So this is very important for us to clearly disseminate the information. In a case of autopsy, a full autopsy will be ordered if you have a suspected criminal investigation where people are suspecting this person of foul play in this person's death, where a full scientific autopsy investigation is done to establish what caused the person's death. In the case of this COVID era, we are looking at post-mortem testing or testing of the dead in the sense of ruling out if the person died from coronavirus or not. So this is very, very important for us to clearly understand this. So the question referring to what happened when an asymptomatic person died. So this is why it's very, very important for us to test the dead persons. Because in the case of coronavirus, you see it's possible that someone that is not showing any signs and symptoms can carry the virus. So if such a person dies, how do you know that this person died from coronavirus or not? The only possible means of being able to know is to do testing. So that's why encouraging people to do tests, especially testing of the dead where you have unknown causes of death. If the person died during the corona era and you don't understand what caused their death, it's very important for you to alert the health authorities so that specimen can be collected from this person to establish whether or not this person died from coronavirus. So this is very, very important, and this justify why we have to test the dead, because there are other people that may not show signs and symptoms, and when people die in such a situation where you don't understand the cause of death, what we have categorized uh, as unknown cause of death, you have to be able to establish whether or not that person died from coronavirus or not. So these are the reasons why it's very important for us to do testing for people that die or post-mortem testing. Yes, so the question referring to whether we're working with funeral homes or funeral parlors in ensuring under the incident management, one of the pillar is the dead body management pillar. So the dead body management pillar is closely working with the community, with funeral home regarding issues of dead body. So there have been instances where the collaboration between the communities, the funeral home, and the dead body management team has led to the sample collection team going in and collecting specimens to take to the lab for testing. And some of these cases have been confirmed positive, and some have also been shown to be negative. So it's very important in terms of working together as a team. And I think that is why it will be very important for you as journalists to understand these things and be able to pass the information out, and also working with communities in terms of disseminating the information so that they understand. So I want to thank you for the opportunity, for the invitation giving me to come and share my experience and my expertise. So it's always a pleasure to share my expertise, to be able to give you the right information so that you help us in sending the information to your audience so that they will have the right information to be able to make impact and for us to protect our fellow Liberians and others that will get this information to be able to know the importance of us doing testing on people that die is not that we just want to test people that die. I can tell you that Liberia has been one of the countries that started this, and other countries has followed. So we lead and others follow. So this is very good for us. It has been guiding us in identifying hotspots, communities that we have focused our public health intervention on in terms of doing massive testing to understand what is happening in those communities. So we did that in the, for example, the Tinker Village community. It was a targeted community for epi surveillance. We did that in Dupo Rural, and we just completed that in West Point with the enhanced surveillance. So we think it's very important for us to send this information, and so the community can be able to cooperate with the health authorities to be able to have this, so that we collect more and more sample from the dead. It will help us in understanding what is happening in other communities that these people might have originated from. Sometimes what you see is someone will come from Lofa and come and stay here for some time and die. So if we are not able to get the information to collect specimen to test, to follow up contacts first from here in Monserrado and now move back to Lofa to do contact tracing, you will see that you have silent transmission of the virus within a population. So you have active transmission going on, and health authorities will not know. Before you get to understand, you see that from that one case, you might have had more than 40 or 50 different cases that might have taken it to different locations. So this is a collaborative effort, and we all need to work together in this. Thank you very much.